tools, including models that were used to generate a number of future scenarios. Nous adoptons une approche qui utilise plusieurs données et outils de modélisation.
We are using data and models to guide our decisions. These models will help us to generate a number of future scenarios.
This briefing will share with Canadians our data and modeling and how they guide our planning and actions to control the epidemic and ready the healthcare system, working with provinces and territories. Durant cette séance d'information, nous partagerons
During this information session, we will be sharing with Canadians our data and modeling that are being used to guide our planning and decision with respect to measures to take to control the epidemic and protect the healthcare system in conjunction with the provinces and territories.
The briefing will be provided by Dr. Theresa Tam and Dr. Howard New, the Chief Public Health Officer and Deputy Chief Public Health Officer of Canada. La séance d'information sera fournie par la Dr.
The briefing session will be provided by Dr. Tam and
de la santé publique et le Dr.
Howard New,
sous-administrateur en chef de la santé publique,
the Chief Public Health Officer of Canada and the Deputy.
There will be an opportunity to pose questions to Drs. Tam and New, supported by technical experts from the Public Health Agency of Canada. Dr. Nicholas Ogden, Director of the Public Health Risk Sciences Division, Dr. Ping Yan, Research Manager of the Modeling and Projection Section, and Dr. Rachel Rodin, Scientific Director and Senior Medical Advisor. Après l'exposé, il y aura l'occasion de poser des
Following the presentation, there will be an opportunity to ask questions to Dr. Tam and New, supported by experts from the Public Health Agency of Canada. Dr. Nicholas Ogden, Director of Public Health Risk Sciences, Dr. Ping Yan, Researcher on Modeling, and Dr. Rachel Rodin, Main Scientific Advisor.
Sur ce, je me tourne vers Dr. Tam.
Dr. Tam, you have the floor.
Thank you very much. Good morning. Bonjour à toutes et à tous. So we're going to turn to slide 2. We are using data and models to guide our decisions. These models help us gain an understanding of where we are in the epidemic and where we might be heading. While models are imperfect, they do allow us to forecast infection and illness rates in the short term and explore the effectiveness of combinations of public health measures for controlling the epidemic. Models are highly sensitive to our actions. Data and models can help Canadians see how our individual and collective efforts, including staying home when possible, maintaining physical distancing, self-isolation, quarantine, and preventing the importation of infection, can determine the trajectory of Canada's COVID-19 epidemic. Models, especially at the provincial and local level, can help inform health system preparedness.
Bonjour. Diapositive 2. Nous utilisons
Dr. New, good morning. We are using data and models to guide our decisions. These models help us to gain an understanding of where we are in the epidemic and where we might be heading. While models are imperfect, they do allow us to forecast infection and illness rates in the short term and explore the effectiveness of combinations of public health measures for controlling the epidemic. Data and models can help Canadians see how our individual and collective efforts are important for containing COVID-19 in Canada, especially when it comes to the measures such as staying home, physical distancing, self-isolation, quarantine, and preventing the importation of the infection from other places.
This slide illustrates a very important concept. Our objective is to control the epidemic by reducing onward transmission through public health actions to push that blue curve down, while we build up healthcare capacity at the same time to push that dotted red line up. What we want to do is to keep the blue curve below that red line in order to reduce the overall total impact of this epidemic as fast as possible.
Diapositive 3.
Dr. New. Slide 3. This slide illustrates a very important concept. Our objective is to control the epidemic by reducing onward transmission through public health measures to push the blue curve down, while we build up healthcare capacity at the same time to push the dotted red line up. What we want to do is to keep the blue curve below the red line.
So how do we make sure that epidemic dies out? Before strong public health measures were put in place in Canada, we estimated that each individual passed on the virus to just over 2 additional people. We have since taken a series of critical public health actions with testing and isolation of cases, contact tracing and quarantine, and Canadians are practicing physical distancing. These actions are helping to reduce the average number of people each case infects by breaking the chains of transmission to the point where each infected individual is transmitting the virus to less than 1 individual on average. The epidemic will die out.
Diapositive 4.
Dr. New, slide 4. Before public health measures were put in place in Canada, we estimated that each individual passed the virus on to just over 2 additional people. Since we have taken a series of critical public health actions, we have put in place a series of public health measures that are essential to achieve our objective of containing the epidemic. For example, testing and isolation of cases, contact tracing, and quarantine, including raising public awareness. These measures together are essential to break the transmission chain.
So, slide 5. In the next few slides, we're going to have a look at where we are with this pandemic in Canada right now. Next slide, slide 6. So this slide shows a snapshot of the epidemiology as it stands, and it is always evolving. So the number of cases or the case rates are different across Canada, and they are constantly evolving. The epidemiologic picture shows that there are regional differences, certainly with the bulk of cases in 4 provinces, British Columbia, Alberta, Ontario, and Quebec. All provinces and territories, though, are affected, with the exception of Nunavut, that has not yet reported a case. So we are also tracking severe outcomes, including deaths in long-term care facilities. We should note that these numbers are based on laboratory confirmed cases, but we know that it paints an incomplete picture, as many more cases are not formally detected or reported.
Diapositive 5.
Dr. New, slide 5. We're now going to look at epidemiology and the pandemic in Canada today. Slide 6. The epidemiological picture in Canada continues to show that there are regional differences, with the bulk of cases in Columbia, Alberta, Ontario, and Quebec. However, all provinces and territories, with the exception of Nunavut, are reporting cases. These figures are based on laboratory figures, and we know that it paints an incomplete picture because many more cases are not formally reported. We also have a high level of death in long-term care facilities that we are tracking.
So slide 7. The impact of the virus is local. Canada's cumulative case curve, which is in the black solid line, is an aggregate of a series of regional epidemics. Many factors, such as differences in the timing and pattern of community spread, for example, the timing of March break, or changes in laboratory testing, and the introduction of different public health measures on slightly different timelines, can lead to regional differences.
Diapositive 7.
Dr. New, slide 7. Here we can see that the impact of the virus is local. These differences in timing and pattern of community spread can be due to matters such as the timing of March break, and the different public health measures on slightly different timelines can lead to regional differences.
This slide compares how fast the epidemic is growing in a range of countries. For comparison purposes, each of the countries' curves are aligned to day 0, the day the country reached 500 cases. Canada's epidemic, which is the red curve, is in earlier stages. The line is shorter than others. There are then a series of straight dotted lines, which some of you may be able to make out, which speaks to the slope, and therefore the speed of the increase in cases. Canada's total case count have been increasing more slowly than most countries. We can see the number of cases are doubling every 3 to 5 days, which is comparatively a positive trajectory. Part of this is due to the learning we have taken from the experience of others and the approaches they have taken. This has allowed Canada to act earlier to control the epidemic.
Diapositive 8.
Dr. New, slide 8. This slide compares how fast the epidemic is growing in a variety of countries. We can see a constant accumulation and changes as countries put in place measures, reflecting the trajectory in each country. It's important to look at the dotted line, which shows the speed at which the cases increase. We can see in Canada that the number of cases is doubling every 3 to 5 days, which is a comparatively positive trajectory. The total number of cases in Canada has increased more slowly than in many other countries. This is in part due to the learning that we have drawn from the experience of others and the approaches taken. This has allowed Canada to act earlier to control the epidemic.
I just want to add on this slide that the Canada's line is not a straight line upwards. As you can see, it's beginning to bend a little bit, which means that the growth rate is slowing down a little bit. So in the next series of slides, we're looking at our modeling scenarios. Slide 10. It's important to recognize that models are not a crystal ball and cannot predict what will happen. Models help us understand what could happen under various scenarios to allow us to prepare for the worst case and drive public health action to enable the best possible outcome. Models are used in public health to support decision-making on public health measures and to ready the healthcare system to plan for an expected number of COVID-19 patients. Nationally, we are using 2 modeling approaches, forecasting and dynamic models. In forecasting models, we use actual data on the cases we have seen in Canada to estimate how many new cases we may expect in the coming week. Dynamic models allow for a longer-term view using our knowledge, which is evolving, of how the virus behaves. It helps us look at different scenarios and the impact of public health measures taken over time. It is certainly important to recognize that all models have limitations.
Diapositive 9. Maintenant, on va regarder
Dr.
les
New,
scénarios
slide
de
9.
modélisation.
We're now going to look at modeling scenarios.
Diapositive 10.
Slide 10.
Il faut bien comprendre que les modèles
It is
ne
important to
constituent
recognize
pas une boule
that
de cristal
models are not a
et ne
crystal
permettent
ball
pas de prédire
and
ce qui
cannot
se
predict
passera.
what will happen.
Les modèles fournissent des prévisions de
Models
ce qui
provide
pourrait
a
se
prediction
passer
of what
sous divers
could happen
scénarios.
under various
Ainsi,
scenarios.
ils nous permettent de nous préparer
That allows us to prepare for the worst case and to drive public health action to enable the best possible outcome. Models are used in public health to support decision-making on public health measures and to ready the healthcare system to plan for an expected number of COVID-19 patients. Nationally, we're using 2 modeling approaches, forecasting and dynamic models. Forecasting models use actual data on the cases we have seen in Canada to estimate how many new cases we may in fact expect in the coming week. Dynamic models allow for a longer-term view using our knowledge of how the virus behaves, helping us to look at different scenarios and impacts of measures taken over time. It's important to recognize that models have limitations.
So on slide 11. So this is our forecasting model to look at the short-term epidemic trajectory. This slide illustrates 3 possible trajectories generated by this model, recalling that this kind of model is based on reported Canadian case data. Our forecast predicts that we will see from about 22,580 to about 31,850 cases by April the 16th. Based on the case fatality rate to date, this could mean we reach between 500 and 700 total deaths in Canada by next week.
Diapositive 11.
Dr. New, slide 11. This slide illustrates 3 possible trajectories generated by a forecasting model. And recall that the forecasting model is based on reported Canadian case data. Our forecast predicts that we will see about 22,580 to about 31,850 cases by April 16th. Based on the case fatality rate to date, this could mean we reach between 500 and 700 total deaths in Canada by next week.
So on slide 12. So this shows the kind of method used by dynamic models. Dynamic models simulate the experience of individual people. So this is a novel virus. All people start as susceptible. Some will be exposed, and those exposed may become infected. These models also include different stages of the disease, from getting exposed, then infected, becoming symptomatic, and then maybe hospitalized, and then the patient recovers. Of course, there's also some serious health outcomes, including death. And modelers will use as much of the scientific information as possible, which changes over time, to populate the parameters for each of these stages of disease. So the consideration of all of these factors produces the modeling scenarios, and the different modeling scenarios produce different outcomes. We can also input measures that reduce the spread of infection, what we call mitigating factors, and others that could increase spread.
Diapositive 12.
Dr. New, slide 12. Dynamic models of scenarios. Dynamic models stimulate the experience of individual people. All people start as susceptible. Some will be exposed, and those exposed may become infected. Models also include the different stages of the disease, from getting exposed, infected, becoming symptomatic, hospitalization, recovery, or death. The consideration of all these factors produces modeling scenarios. Different modeling scenarios produce different outcomes.
So slide 13. So this is an important slide as it applies the kind of measures that we have been putting in place to date to see what happens to the models. So a series of models were synthesized to generate a number of scenarios, including no control, some controls to delay and reduce the peak, and stronger epidemic control measures. So from this, we can discern the range of the population infected, what we call the attack rate, and the potential duration of the epidemic. So stronger epidemic control models that you see at the bottom here on the green box, in the green box, these stronger epidemic control models include a high degree of physical distancing, a high proportion of cases identified, and a high proportion of contacts traced and quarantined.
Diapositive 13.
Dr. New, slide 13. This is a very important slide. as it applies the measures that we have been putting in place to date. A series of models were synthesized to generate a number of scenarios, including no control, some controls to delay and reduce the peak, and stronger epidemic control. From this, we can discern the range of the population infected and the potential duration of the epidemic.
Slide 14. This slide illustrates the three possible scenarios that we just talked about. The red curve with a very high peak over a relatively short period of time is the no control scenario, or the worst case scenario, where the majority of the population could be infected. The blue line shows a scenario with weaker controls, leading to the delay and reduction in the peak. The green, smaller curve is the best case scenario in which we reach out our objective of epidemic control. So this is the scenario we're working towards, where each infected person only transmits to less than one person. We can stay on this green curve by achieving high and sustained degree of physical distancing, and at the same time a high rate of case detection and self-isolation and contact tracing and quarantine.
Diapositive 14.
Dr. New, slide 14. This slide illustrates the three possible scenarios we just talked about. The red curve with the high peak over a relatively short period of time is the no control. The blue line shows a scenario with weaker controls to delay and reduce the peak, and the green curve is the best case scenario, which is we reach our objective of epidemic control. In this scenario, we're working towards a situation where each infected person only transmits to less than one other person. We can stay on this green curve only by achieving a high and sustained degree of physical distancing and at the same time a high rate of case detection and self-isolation.
Slide 15. This slide shows the cumulative severe outcomes, critical illness resulting in death, for the three different scenarios. So in the green bars, that is the green small curve, that is the epidemic control scenario. The blue bars show the weaker controls, and the red bars show what happens when you have no control. And at the x-axis, you have the percentage of the population infected, and on the y-axis, the number of deaths. So these stock numbers tell us that we must do everything that we can now to remain in that best case scenario, to stay in the lower range of the green zone with strong epidemic control. Our collective efforts, despite all the hardships and the costs, is critical, as we must minimize the population infected, that's on the x-axis, in order to keep deaths, ICU admissions, and hospitalizations as low as possible. The resolve and the level of effort of all Canadians, from our healthcare workers on the front line to public health authorities, to all Canadians who are practicing physical distancing, will ultimately determine whether we can remain in this best case scenario and ensure that our health system can cope. We cannot prevent every death, but we must prevent every death that we can.
Diapositive 15.
Dr. New, slide 15. This slide shows the cumulative severe outcomes, critical illness resulting in death, for the three scenarios in the previous slides. The bars in black show no measures put in place. The bars in blue and the best case scenario are in green. Our objective is to remain on the best case scenario line in order to reduce the number of deaths. We must minimize the number of people who are affected and hospitalized. This will keep deaths as low as possible. The resolve and level of effort of all Canadians, from our healthcare workers on the front line to public health authorities, show that if we practice physical distancing, we will be able to remain in this best-case scenario. We cannot prevent every death, but we must prevent every death we can.
So slide 16. This shows our collective ambition across Canada, which is to achieve epidemic control, to not only minimize the cases and the severity of impacts, but to minimize the duration of that first wave. I just want to emphasize that even once we're past the peak of this first wave and on the downward trend on the other side of the curve, it will be equally critical to keep up with our control measures. If we let up, new chains of transmission will take off in our highly susceptible population, and the epidemic will reignite. If we are to not lose our hard-won progress, we must stay the course until we have reached a very low number of cases at the bottom of that first wave. However, even with epidemic control, we anticipate that some public health measures will need to remain in place to prevent the growth of future smaller waves.
Diapositive 16.
Dr. New, slide 16. Our collective ambition is to achieve epidemic control. It is essential to quickly control the epidemic during this first wave. However, even with these measures in place, we expect that some public health measures will have to remain in place to prevent future waves. If we don't want to lose our hard-won progress, we will have to stay the course until we have reached a very low number of cases. Once we have past the peak of the first wave and are on the downward trending side of the curve, it will be equally critical to keep up our control measures. If we do let up, new transmission chains will take off in our highly susceptible population, and the epidemic will reignite.
So on slide 17, so what do we need to do now to determine our future? Next slide, slide 18. So to keep on that green curve, we have to continue to implement the public health measures we have put in place. We have to keep an eye on that trajectory to see if increased measures are needed, so that we can continue to aim for the lowest possible infection rate to both minimize illness and deaths and to shorten the duration of the epidemic. We have to prepare our health system to expand our health system capacity. Recognizing that even if successful, some public health measures need to be sustained to reduce both importation and domestic transmission. The epidemic is not the same in all parts of the country, so the control measures will have to be readjusted depending also on the local epidemic situation. It is too early to know how close we are to the peak from a national perspective. However, we are discussing with all chief medical officers of health what more should be done to keep us on the path of epidemic control. Once we've observed significant progress in getting the epidemic under control, we will still need to have highly sensitive testing in order to alert us to any new cases occurring so that we can trace and stamp out any chains of transmission quickly.
Diapositive 17.
Dr. New, slide 17. What does our strategy look like? Slide 18. We are continuing to implement the measures we have put in place, and we are keeping an eye on the trajectory to see if increased measures are required so that we can continue to aim for the lowest possible infection rate and to shorten the duration of the epidemic. Recognizing that even if successful, some public health measures need to be sustained to reduce both importation and domestic transmission. The epidemic is not the same in all parts of the country. As a result, when control measures can be readjusted, decisions will be based on the local epidemic situation. Some regions may be able to relax some measures, while other areas of Canada cannot. It is still too early to know how close we are to the peak from a national perspective. However, we are discussing with all medical health officers what measures should be taken to keep us on the path of epidemic control. Once we've observed significant progress in getting the epidemic under control, we will still need to have highly sensitive testing, and that will be in order to alert us to any new cases occurring so that we can trace and stamp out any changes of transmission quickly. We will be back in the coming weeks to provide an update on our progress as the impact of our measures becomes more evident.
Slide 19. So in conclusion, while some of the numbers released today may seem stark, Canada's modelling demonstrates that the country still has an opportunity to control the epidemic and save lives. We cannot prevent every death, but we must prevent all the deaths that we can. We all play a role in what the future will hold for Canada's COVID-19 trajectory. We must continue to control the epidemic using tried and true public health measures, including asking every Canadian to stay at home whenever possible, maintain physical distancing, meticulous hand washing, and cover our coughs. What we do together now to stop the spread of COVID-19 will reduce the impact of the epidemic and determine how soon we can readjust our public health measures. What we do together now will buy us more time to further understand the virus and to develop treatments and vaccines. We are the authors of our fate. Together we can plank the epidemic curve.
Diapositive 19.
Dr. New, slide 19. While some of the numbers released today may seem stark, Canada's modelling demonstrates that the country still has an opportunity to control the epidemic and save lives. We cannot prevent every death, but we must prevent all deaths we can. We all play a role in what the future will hold for Canada's COVID-19 trajectory. We must continue to control the epidemic using tried and true public health measures, such as asking every Canadian to stay at home, wherever possible, to maintain physical distancing, to meticulously wash their hands, and to cover their coughs. What we do together now to stop the spread of COVID-19 will reduce the impact of the pandemic and determine just how soon we can readjust our public health measures to a new normal. What we do now will buy us more time to further understand the virus and to develop treatments and vaccines. We are the authors of our fate. Together, we can plank the epidemic curve.
Thank you, doctors. We will now open the telephone line and the floor to questions. Vous pouvez poser vos questions dans les deux langues officielles. We ask that you limit yourself to one question and only one follow-up. We'll take 3 questions from the phone. For those asking questions in the room, we also ask that you make your way over to the freestanding mics. Over to you, operator.
Merci. Alors, au téléphone, si vous voulez poser une question, faites étoile 1. There will be a short pause while the participants register. Courte pause pendant que les participants s'enregistrent.
There will be a short pause as participants register.
The first question is from Marika Walsh from the Globe and Mail. Please go ahead.
Hi there, thank you. Dr. Tam, I'm wondering if you can just articulate for us specifically if we need to be doing more than what is already in place publicly to get to this sort of green area where between 11,000 and 22,000 are predicted to die, or if we are already doing everything that needs to be done.
Well, I think in the last weeks, a lot has been done. And we will need to monitor every single day the evolution of the outbreak and the trajectory so that we can recalibrate as as needed. So depending on where that curve is bending downwards, or if we need to do more in order to ensure that that is what's happening. So it is a pretty dynamic process. However, we are trying to improve on every aspect of our response as we speak. For example, we are doing a number of efforts, different approaches to enhance our lab testing capacity, for example, right now, because we know that a key part of our staying on course for that green zone is to ensure that we are detecting cases and we are managing contacts. So we're learning from across the country how best to do contact tracing, trying to enforce the human resources that might be needed to do that, looking at whether technology can help with contact tracing. These are all happening right now and supporting people in self-isolation. And so, the short question is, yes, we will continue on all of these fronts to just make sure that we stay on course, but we really got to look at this dynamic situation every single day as we speak.
And if I could have a question, I just wanted to understand with Ontario, if are they doing those really strong?
Ms. Wash, I cannot hear you.
You're cutting off, Marika. Can you just repeat your question, please?
Yeah, can you hear me now?
Yes.
I'm wondering, for example, with Ontario, do you see Ontario doing these really strong measures that you're talking about as being needed, given that they have the lowest testing, for example?
Well, I think, as you've seen, a whole series of briefings from Ontario stepping up all of their measures. And so I think we are here to support our National Microbiology Lab and the agency, Health Canada. Other departments actually are ramping up to make sure we can escalate our laboratory capacity in this country as a whole. So we will be supporting Ontario whenever the need arises.
Next question, operator.
Thank you. Prochaine question, Hélène Buzetti, Le Devoir.
The next question is from Hélène Buzetti from Le Devoir.
Dr. Tam, I'd like to go back to slide 15. First of all, I'd like for you to clarify the time frame for those deaths. Are we talking about until the end of April or until the end of 2021? And also, I'd like you to reconcile those numbers, because we know that Quebec is the province where there are most cases, and yet when Quebec released its own numbers, its own projection last week, its best case scenario was 1,200 deaths, and now you're talking about 11,000. So I have a hard time reconciling both.
Yes, so of course each jurisdiction will use a combination of different modeling for their own planning purposes. And as I say, these are different scenarios, so they may be using slightly different parameters for their numbers as well. But of course, as I said, at the national level, we're really an aggregate and composite picture of all the different regional and provincial outbreaks. So certainly Quebec will use their real-time information to adjust their modeling as needed as well. So in terms of the timeframes, so the heading of this slide is that over the course of the pandemic. But if you sort of look back one slide before that, which is slide 14, you can see that the duration of the course of that wave is actually a bit different for the different scenarios. So if we achieve stronger epidemic control, spread over a longer period of time. So the time frame is over the course of that wave.
And as a follow-up, I think you mentioned it in your presentation, but when do you expect the peak to happen? Can we talk about it nationally? Because I know in Quebec they talked about 18th of April. In Alberta, I think they talked about mid-May. Is there a peak? Is there such a thing as a peak date for Canada?
Well, Canada, as I've said, our epidemic curve is a composite then of all the different curves in the different jurisdictions. So for sure, we need to look very carefully at each of the provincial trajectories on top of the Canada aggregate. So I actually think the aggregate Canadian curve really doesn't tell the complete story. You do have to break it down into the different provinces and territories. What I will say is, of course, we're looking for signs of that bending of that curve, the slowing down of that growth rate. But because of, as I've mentioned always, the delay in when someone got infected to the time that they are diagnosed, tested, and reported, that could be a space of at least 2 weeks. And during that time, you have to be really cautious. You don't actually know the peak until you've passed the peak. That always happens. You can't tell whether you've reached the peak until after the peak had actually been realized. And so I would just take it a day at a time and look very carefully in the coming weeks. I've said in some areas of the country, this week is very important, the next week is very important. That timing of when that peak might occur can occur at different times in different parts of the country. As I said, what I really want to emphasize is that even if you're seeing some bend and that peak retrospectively occur, the downward slope, if you look at the downward slope, there's 50% of the cases, if that's a symmetric curve, still occurs on that downside of the slope. You cannot let go of those public health measures if you see that downturn.
Thank you, Doctor. Next question.
Thank you. Merci. The next question is John Edison, The National Post. Your line is open.
Dr. Tam, presumably you've ruled out the 70%, 80% infection rate. But where do your forecasts suggest we are on that graph? Are we at 25%, 50%, or even 10%?
The answer actually is we don't know. We are at the fairly early on. Canada is in our epidemic. So right now, we have, think as of today, the numbers will change. Say 20,000 cases. We may have, even if you double that number, we're at 40,000 cases. But that's only when you're starting that epidemic curve, and the more that we can do now, the smaller number that would be. And so again, these models are very sensitive to our actions, and so we can't actually say. All I can tell you is that we stand a really good chance of absolutely staying in that green zone if we try and continue everything that we're doing now.
Okay, thank you.
So now we'll turn to the room. We'll start with Julie and then Glenn.
Sorry. Okay, here we go. Sorry, Julie Van Dusen, CBC. Can you give us a rough idea from all your modeling exactly, we've all been living under restrictions for weeks. When do you think the tightest restrictions will be lifted? And how can that even happen unless all Canadians are tested? Because many might be walking around with no symptoms, infecting each other, even when the restrictions are lifted.
I think that is the question that most Canadians are probably asking right now. So again, we don't know if we've reached a peak anywhere in Canada as yet. So it is too early to tell, and we've got to really look very carefully day by day at where the trajectories are going in different parts of the country. We will not know that we've passed the peak until retrospectively we will know. On the downward side on the curve, we cannot let go of any of our public health measures. The moment you release anything, the chains of transmission is going to ignite. So you're going to have to get that initial epidemic to die out, to stamp it out. And so at the end of which, things have to be recalibrated. So as I said, we are going to look towards countries that have gone before us to learn, if they are beginning to relax their measures, what they might be doing and learning from their experience. At the same time, I think right now is a period of time when across the country we're coming together to say, well, how do we determine the effectiveness of our public health measures? How do we determine the potential negative consequences of the measures that we've already taken? And then how do we very cautiously potentially lift some of them, depending on our data and what that shows at that time? All I can say is that it will be a very cautious approach because right now the population is susceptible. So anything that we do must not reignite another chain of transmission. So, I can't be extremely precise with the timing of that. But again, everything that we do now will shorten that period of time.
So doctors, your message has been for days now, stay in your bubble. And we know not everybody's staying in their bubble, including anecdotally, we hear boyfriends going to see girlfriends that live at different houses and so on. This weekend's going to be a huge test. We're heading into a holiday weekend. Do you have any advice? What will you be doing? People are going to want to get out of their bubbles and go into other people's bubbles.
It is difficult for everyone living in Canada. We're not used to some of these behavioral changes we're asking every Canadian to take. But I think if you can put in that image in your head of what could happen, the really severe consequences that can happen if we don't all do our part. So staying at home, only having dinner and religious observations with your immediate family members, don't invite other family or friends over, is extremely important. We are in a very critical time period. But just remember what could happen if we don't try really hard at this time. And I think practicing physical distancing outside as the weather improves, people will be wanting to go out, but maintaining that 2-meter distance. Of course, I think there's some innovations. There are different innovators with applications, for instance, that tries to nudge people to do the right thing. Feedback from a number of studies, for example, even the Google study that shows a reduction in mobilization movement of people, I think should be a great stimulation to say, look, Canadians, we've done actually pretty well. We've restricted movement quite a bit just based on what Google has been telling us in terms of mobile phone and movement data, for example, but we can do better. And so studies like those helps us sort of look at them and go, okay, well, we can reduce our movement and stay at home as much as possible. But it is a matter of life and death, really. And when I say, we are the authors of our fate, this is something that is really serious, and every Canadian should do our utmost. And we know we can. We're a resilient group of people. We want to protect others. So I think, everybody will be doing their best.
I'll just add to that sort of a personal example from myself. We're going to have a virtual Easter. I have 3 children. One's in Ottawa. She's a university student. She knows she's out there, and she hasn't been living at home with us since this began. And my 2 boys are in Quebec. They're in Montreal, actually. So we have lots of great video conferences, and we'll plan to have a virtual Easter over dinner, over a webcam. Pardon me? Of course it's hard. We're used to having family gatherings. It's a great tradition that we have, and I think lots of families across Canada. But we know that these are extraordinary times. My children understand that. My partner, myself, we're in our own bubble at home, and the kids, they recognize they need to be in their bubble.
Thank you, Glenn.
Glenn McGregor, CTV News. On chart 15, it specifies the number of deaths only for 2 scenarios between 2.5% infection rate and 5%. Just wondering if you think that's the range we're in now. So those are kind of based on what we're doing. That's the best and worst case scenario if we keep doing what we're doing now. And secondarily to that, in the very best case scenario of a 1% infection rate, is that attainable? And if so, if you use that same death rate, that would still mean 4,400 deaths by my calculation. Is that kind of the absolute best scenario?
Again, all of these scenarios are scenarios, and they are very sensitive to the action that we have right now. I think the 2.5 and 5% is the sort of mid-range of that best, strongest epidemic control scenario as an illustration of the kind of numbers that you will get if you put these scenarios through this range. And I think, looking at 2.5 to 5%, it's just, they are just scenarios. But I think looking at those range helps planning from a health system perspective. I think that attack rates or the percentage of populations infected beyond those ranges will mean that the health system will find it really difficult to cope. So what we want to do is to stay under that kind of trajectory.
Okay. These models are based on what death rate exactly? Because that's kind of a guess because you don't know the total number of people who are infected, correct? So I wonder if you could talk about how that rate was calculated and whether or not you factored in Canada's level of health care compared to somewhere like China or other places in Asia that may not have as good intensive care systems.
Yes, so the dynamic model that we talked about will input a variety of those factors, the mathematical calculations, and different ranges of sensitivity around each of those numbers. And even our case fatality, or what we call the sort of crude case fatality at this time, will vary. And I have to point out that on the epidemiology slide, I did say that a great proportion of our deaths, unfortunately, are linked to long-term care facilities. So understanding what those deaths are tells us what to do to improve our final outcomes. So with that population being quite severely impacted, you're seeing a current case fatality of around 2%. But the modelers, some of whom are on the phone, will have parameters and sensitivity and a range that will input to give us some of those measures. Yes, so if you're seeing clusters concentrated in older population, you're going to see a higher fatality. If you look at the Canadian population in a more homogeneous way, of course, that may reduce that. So the models will look at the dynamics of transmission as well. I don't know if Dr. Ogden will want to add anything.
Well, I would just note that those models and the specific parameter in terms of death rate are informed by international studies and work in Canada by our modelers at the Public Health Agency and the network of experts across the country they work with from both provinces and territories and academia.
Thank you, Maura.
Yeah, thank you, Maura Forrest, Politico. I just wanted to get back to this question of 11,000 to 22,000 deaths. I just want a bit more clarity about how we should talk about these numbers. These are the numbers we're all going to latch on to because they're the only numbers that you've provided here. We're all going to report those numbers. So how do we write about those? Is that sort of the most likely scenario at this point? Is that the most optimistic scenario at this point? Like, why did you only provide those figures?
Well, I think we can certainly provide a whole range of figures. These were selected in the middle of that strong epidemic control range, but also to illustrate how severe the outcome could be in those scenarios, even if we, of course, put in a lot of strong epidemic control measures. And where we end up in that range will, again, depend on the actions that are taken. So they are there to illustrate what the output is for the 2.5% attack rate, or the percentage population infected, and the 5% population infected. And as I've said, that is actually over the course of that whole epidemic wave. The other kind of modeling that particularly happens at the provincial level is to model the shape of that wave and look at that very peak of that curve. because you want to make sure your health system and all of its measures are below that peak. So that's how we interpret it. But as you can imagine, it's not that difficult to sort of project it. In the bars, you can't really read very well, but they do give you that whole range of numbers as you sort of move up the curve if you actually slide yourself across to that y-axis. But this is used as illustration, but as I said, round about that 2.5% population infection rate is the point at which the healthcare system could be very pressured in terms of its response. So, looking at that range is actually quite important.
And you also mentioned that the rate of growth is slowing. Does that mean that we are successfully flattening the curve right now?
Well, I think all chief medical officers are trying to be extremely cautious about the interpretation, because it doesn't take much if someone relaxes or don't perform as well in some of those public health measures. But what we are seeing is in the composite curve, with all the provinces added together, we are slowing down in our growth. So we are currently between the sort of doubling time of every 3 days to every 5 days. It's actually veering towards a doubling time of every 5 days. That is what we're observing. But we will be monitoring that really closely.
Thank you, Doctor. Let's go back on the phone. Operator, please.
Thank you. Merci. La prochaine question, Lina Dib, La Presse canadienne. À vous la parole.
The next question, Lina Dib.
Oui, bonjour. I'd like to go back to numbers again and slide 15, please. So can you give me the numbers for that green scenario, the 10%, the number of cases, the number of hospitalizations, the number of intensive care, and the number of deaths?
We can certainly provide those numbers for those stronger epidemic control scenarios. I would just emphasize that in looking at this, it's important to remember, as Dr. Tam noted, that we have strong epidemic control measures in place, that we want to stay in the lower range of the green zone with those stronger epidemic control measures. And we are the authors of our own fate in terms of taking collective action to ensure that we guide that future to the best possible outcome.
So can I have the numbers, please? I'm still waiting for the numbers. Can you give the numbers, and can you tell me if you consider that now we are in this green zone of controlling the epidemic? So can you give me the numbers for the 10%? Because I can calculate the percentage of cases, but I can't infer the hospitalization numbers or the intensive care numbers or the deaths.
We will certainly work to provide those numbers in a very short term.
We can follow up with you after, Lina.
Mais voyons. I thought this was a briefing. This is what this is supposed to be for.
It's Dr. New. Maybe I can answer that. Is that certainly with our modelers, there's a wide range of parameters that go into the modeling, as you can appreciate. That it's very sensitive depending on what kind of sort of percentages you put in. So, for example, we're looking at attack rates. So over the whole course of the epidemic, we're estimating in a best case scenario that 1% of the Canadian population will become infected. So if you look at the Canadian population of 37 million, obviously you see that the figure there would be about 376,000. And of course, we estimate that over quite a number of months, not all at once. So that could be over even a year or so if we do our best efforts and continue our public health measures like physical distancing. If you're looking at hospitalization, there's quite a wide range. I could give you a figure. It's a certain percentage. If you look at the data we have to date, it's quite a bit lower. I would certainly about 6-7% or so is a kind of estimates we've seen and the data that gives us a rough idea of what we might expect. And then, of course, data from around the world, plus our own experience in Canada, shows us what kind of percentage or what the number of people that might end up needing an ICU bed, and of course, in the worst case scenario, a ventilator. But you can see that in Canada, we don't have that much data yet that's reported up to national level. And so the data is very sensitive, and therefore, not to, let's say, give you numbers that could change the next day and also alarm people unduly, where we're still, in a sense, at this point, getting the data from the provinces. We recognize there's a delay, and maybe at a future point, we'll be able to give you more precise figures. But that's the nature of modeling.
So just to help you do some, all of us do some simple arithmetic. If you see the 2.5 to 5%, you're multiplying those numbers by 2. So you can imagine if you want the 10%, what you do, for example, hospitalization, for the 10% scenario, you multiply 146,000 by 2. So that will be like 292,000. So that is how we will be able to give you those numbers. Does that help?
Yes, thank you.
Thank you.
Approximately 2%.
Thank you. Next question.
Merci. La prochaine question est de Christian Noël.
The next question, Christian Noël, Radio-Canada. Good morning, everyone. Now, I understand the situation, but Canadians want to understand what's going on as well. What is your best assessment? When will the peak occur based on the various models? What is your best estimate of that? And how long will physical distancing measures be required? The graph appears to indicate a year. Could you give us something precise for Canadians? So the peak and the physical distancing time frame.
Merci pour la question. Voici Dr. New.
Dr. New, thank you for the question. It's difficult to predict when the peak will occur. With an epidemiological curve, we can only know when we've reached a peak once we start seeing the downward trend. After the peak, we can look and say, and realize, in fact, that we have hit the peak and are on the declining part of the curve. So it's difficult in that regard. But we can predict that if we do our best in terms of physical distancing, the first wave may end in the summer. So that's number one, question number one. With respect to the downward curve, 50% of the cases can occur after the peak. So it's important to keep in place the public health measures, physical distancing, etc. We can't give up after the peak. We can't say, okay, we're on a downward part of the curve. We can start getting together again. And no, that's an important point to mention again. We also showed that after the first wave, we expect some smaller subsequent waves as well. So it's, in fact, because the epidemic in Canada isn't like one big epidemic. There are lots of smaller local epidemics in each province. So what that means is that it all depends on what's happening in the provinces and territories. In the future, one province, for example, may be able to put in place measures to relax some public health controls with respect to physical distancing, perhaps a little earlier than another province or territory, because they're at a different point in their curve as well. The journalist. Well, I understand. So depending on the province, then it may happen that physical distancing might have to last until December, for example, then. Dr. New, answer. If we continue with our best efforts, we will attempt to be planking the curve. We hope, in fact, that the first wave I don't have the actual slide or page in front of me, but we see that first wave lasting until the summer, but that won't be the end of the epidemic. We expect subsequent smaller waves, and so that's why it's difficult to say nationally on such and such a date we'll be able to set aside these measures, public health measures that we put in place in the provinces and territories. Nationally speaking, it's a composite of all of the information from the provinces and territories. So if we're talking about Quebec, for example, we have to ask Quebec authorities what is happening there. They've given us some predictions. But for the people of Quebec, they need to stay the course and to look at what happens in the weeks to come. Question. So these physical distancing measures may last until December then? Answer by Dr. New. The physical distancing measures are in effect in each province and territory, and it's up to each province and territory to monitor their epidemics very closely. If it becomes clear that we are on the downward side of the curve, we may be able to relax some measures, but it will be up to the provinces and territories and their health authorities to make a determination as to when that can occur. It's also very important to have a monitoring system in the laboratories to quickly detect cases. Now, if there are delays, we won't have an opportunity to look at what's happening and to monitor the situation. And we may see an increase in cases. Question by Julie Van Dusen in the room, inaudible.
What we're hoping, obviously, is we put our best foot forward, that everyone, all the provinces and territories, the Canadian population keeps at it right now. This is the critical time, especially, as you say, with important holidays coming up, such as Easter and Passover, Ramadan, and so on, that everyone recognizes the importance that even though there are important traditions, this is not the time to have your family get-togethers. As I mentioned, even personally, I'm having a virtual Easter with my family. If our best efforts are successful, then possibly, hopefully, the first wave will end by the summer, but it's not over. Certainly with that first wave, as I mentioned, you won't know if you've reached a peak until actually you're on the downward curve, because it's almost like retrospectively that you'll be able to see that you're on the downward curve. And after that, we certainly anticipate there will be smaller secondary waves. We've talked about second, third, fourth waves, and therefore it's very important to keep at it. One of the key things that needs to happen across the country is that we need to maintain a strong surveillance system and a laboratory system that's able to test, as you put it before, widely in the population. Because if we start, and this is really at the provincial and territorial level, let's say relaxing, if you can put it that way, in terms of certain measures, in terms of physical distancing, because they're on the downward curve, you have to be able to detect very rapidly if cases then pop up again, little outbreaks and so on, because then you might have to adjust as you go on. So it's a very, I think, cautious approach in which each province and territory, even not a province as a whole, but individual regions, cities, and so on, need to look at their local epidemiology, look at what measures are in place, as hopefully we say as a country or in each region, as the epidemic curve looks like it's on the downward trend, have that sort of a good analysis as to see, okay, what can we do to maybe relax certain things? One of the things we've also mentioned is that it's critical, besides a good surveillance system and laboratory capacity, that we need to do our best efforts to protect our most vulnerable populations. So what's been happening in nursing homes and so on, I certainly can see very strict measures still staying in place in nursing homes, in other settings, congregate settings, that certainly if you were to get an introduction or reintroduction of the virus, it could have catastrophic results. So those are some of the key aspects. I'm not going to put a summer, and the thing is, depending on which part of the country, British Columbia, I think it would be considered a perpetual summer compared to the north. It's not for me to say. I would say that sometime in the summer, and that it may vary by several weeks depending on what part of the country. I think most people in Canada know that certainly for summer vacations, July and August seem to be our peak months for summer in terms of taking a vacation.
I'd like to just provide further elaboration on the information on slide 15. These scenarios are modeled on the basis of understanding the transmission of the disease. They're not driven by data, but rather by understanding how the disease is transmitted and the control measures in place. From those, we can determine the percentage of the population infected, as noted on slide 14. With that, we can mathematically determine, based on information obtained internationally and in Canada, as I noted, the number of hospitalizations, the number of potential people in ICU, and the number of deaths. In that regard, over the cumulative span of the pandemic, the assumption is that 8% of the cases would be hospitalized, 2.4% of the cases will need care in ICU, and the case fatality rate is 1.1%. The earlier comment I made about 2.2% is the observed rate of fatality today based on the number of cases. So I just wanted to clarify that point. And based on those numbers, the range of deaths is from 4,400 in a 1% strong control measure, that's where we want to be or better, through to 44,000 in the 10% scenario. As I noted, and Dr. Tam emphasized in her briefing, we have strong control measures in place now. We want to stay in the lower range of the green zone of stronger control measures, because that has the best possible outcome for Canadians. And indeed, we are the authors of our own fate, and the actions that we will take collectively will work to help keep us in the green zone to the best possible outcome.
Thank you. We'll do one last question on the phone, operator.
Thank you. Merci. The next question, la prochaine question de Mélanie Marquis, La Presse.
The next question from Mélanie Marquis from La Presse. Please go ahead.
Dr. Tam or Dr. Arnoux, can you speak to the Quebec curve, how it seems to be much more a problematic situation over there? How can we explain that, that the numbers are so much starker in Quebec than in the rest of the country?
Yes, so I think you're speaking to slide number 7.
Hold on.
Yes. Is that correct?
Yes, I am. Yes.
Mm-hmm. So, so in terms of Quebec, there may be a range of factors. One is that, of course, Quebec is testing a lot of people. At some point in this trajectory, as you can see, there was quite a sharp increase as the testing also accelerated. We know Alberta and Quebec are testing at a very, very high rate, and so are a number of the other jurisdictions as well. But they are experiencing a different outbreak to others. For example, they experienced the March break earlier than the rest of the population at a time when people were still taking vacations overseas. Right now, we have advised against all non-essential travel, and with a lot of other travel measures and advisories and the prevention of foreign nationals, for example, coming to Canada. So I believe that some of those dynamics, like the March break returnees, also contributed to Quebec's upward trajectory at that time. So I think it's a combination of the actual epidemiology and the transmission in that province, together with testing strategies. But the key is that you can then observe, once things stabilize, you can observe that curve and see what happens to it. So each individual curve you can then follow and see what that slope might look like over time.
C'est Dr. News, seulement pour aussi ajouter que ce que Dr. Tam a dit, que
Dr. New replying, Quebec has done a good job to test its population. We know that with epidemiological curves, they reflect tested cases, cases that have been identified, and Quebec has done a very good job identifying cases, testing. As was pointed out by Dr. Tam, their March break was earlier than it was in other provinces and territories. Follow-up question from the journalist. Dr. New, I'd like to go back to the duration, if you will, of physical distancing. It could last until December then, based on my understanding. Dr. New, reply. Now, as I said earlier, if everyone and people in Quebec continue to maintain physical distancing and the other public health measures, if they follow the recommendations from public health in Canada and in Quebec as well, in the province, we expect the first wave to last until the summer. But clearly, at that point, the epidemic will not be over. We expect some small waves to follow that. So this is a matter that the authorities will have to monitor, following their epidemics very closely, monitoring the changes. They may be able to relax some measures as they await the smaller subsequent waves, but it is critical to have a good tracking and monitoring system and a lab system to quickly identify new outbreaks in that scenario. That could cause another wave or an outbreak. So that needs to be monitored very carefully. Clearly, as Dr. Tam and I have said, we agree with the other chief medical officers in the provinces. We need to proceed cautiously based on scientific data. The journalist, then you're talking about the end of the summer then?
Go ahead.
Reply, Dr. Tam. Well, you can see on the slide that the first wave, with our best efforts maintained, we hope that the first wave will end, or we can see that it will last until the summer. Question from Julie Van Dusen in the room, inaudible.
It's difficult to say because every province and territory, even at a very local level, has their own, what we call their own epidemic. So depending, let's say, for example, if you are, let's say, in a community, and I'll exaggerate the point, that has a very, I say, a high proportion of seniors and maybe quite a number of nursing homes, the way you might go forward in terms of the measures that you might either keep in place or sort of slowly relax would be much different from, let's say, another part of the country where maybe the communities are more spread out. Maybe the population density is different. So there's so many factors in play that's difficult to say in general, especially at the national level. Oh yes, at this state, all of Quebec or all of Ontario or whatever province, Alberta, etc., could let go of measures in totality, because you really have to do it at a very, I say, granular or local level.
Thank you. This is all the time we had for today. Please note of the next press conference at noon today. C'est tout le temps qu'on avait pour aujourd'hui. C'est ce qui m'a fait un briefage technique. La prochaine conférence de presse au point de presse.
The next press conference will take place at noon today. Thank you.
All right, and that is the end of the federal briefing on modeling and projections of the pandemic in this country. It is a reminder, our first national picture of where we are in the fight against COVID-19 and where we might end up, depending on our behavior and the public health measures in place. Maybe I'll just give one of the highlights there. We heard at the end from Dr. New, the Deputy Public Health Officer to Dr. Theresa Tam, is that the first wave of this is going to last until the summer. One of the big questions, of course, everyone has at home when you're staying at home is how long are we in this? And Dr. New seems to suggest that based on what they are seeing so far, that this is going to last until the summer, but also stresses that that won't be the end of the epidemic. And that doesn't mean that the strict public health measures that are in place will be loosened entirely, because while there is no treatment and no vaccine, obviously containment is the only way to fight off the virus. I will get to my colleagues in just a moment, but first I want to go to Dr. Ian Bogosh, who has been with us throughout much of our coverage on COVID-19, because he's a lot smarter than me about all of this. So, Dr. Isaac Bogosh.
No problem.
Let's start, Dr. Bogosh, with whether you think whether you have a different sense of things now based on the picture we got there from public health officials.
No, I thought this was really accurate. I like how they projected these different approaches of, where would we be if we did nothing? Where are we in if we do a moderate job in our public health measures and adhering to those measures, and where would we be in ideal circumstances? And I think that really portrays a very accurate picture. And I know I get it. These are models. This is not a crystal ball. This is just to help shed light on where we might be. I think it's really a very fair description of where we could possibly be. And I also like the approach of showing, if we didn't do anything, this clearly could be sadly a lot worse than what it is now.
I agree. I thought it was well done, but there were some pieces, I guess, that were missing, and that was obviously frustrating for some journalists. So they did give a sense of the deaths over the course of the pandemic. If 2.5% of the population were infected, 5% of the population were infected, and then they said if there are no controls put in place whatsoever, obviously that's not a scenario we're in, you could see as many as 300,000 deaths. But they didn't really give the information in between. For instance, if we get above a place where 5% of the population is infected, we don't know how many people that means we might see in hospital. We don't know exactly how many deaths. We don't know how many people would end up in the ICU. Is that problematic, or should we? I imagine we should want that information, or is that because they really think that we are in the best case scenario right now?
I'm not sure. I'm not sure why they parlayed what they did. I do think it was helpful, but as you point out, more data would have been nicer. And if we look at the projections, I just took some notes on my little sticky pad here. But if we do look at the projections from the 2.5% to the 5%, they essentially just doubled their numbers. I mean, right. They just, for example, 11,000 deaths if 2.5% of the population was infected versus 22,000 if 5% was. And then, of course, they looked at, the numbers of deaths in much higher projections. While it's not entirely accurate, we sort of can do back of the envelope calculations to get a better idea of what this may be in situations where there's 10 to 20% of the population affected. But on the other hand, it is nice to be spoon-fed. It would be nice to have some graphics looking at all of the projections as well.
One of the things that they said is that the Dr. Tam said, and I think we knew this, but Canada's obviously in the early stages of the epidemic. She also said, though, that we are seeing a slight, very slight bend of the curve, because the number of cases doubling is now at 3 to 5 days. How do you read that? How encouraging is that for you?
Oh, I mean, so first of all, it's so exciting to hear that, but I just have to bring it back down to planet Earth and really temper this response. And we're starving for good news. We're starving for a win here. And if there is evidence of that, I mean, that's wonderful. But I think it's still a bit too soon to be optimistic that we're headed in the right way. We might be, but I don't want to cloud my judgment or anyone else's judgment, and still want to look at the data in the most objective way possible. Sure, these really might be early signs and small arrows pointing in the right direction. We've seen it in BC and Alberta. Is it reflective of the entire country? I don't know. Is it largely being driven by BC and Alberta, but perhaps not so much in other places like Ontario? I don't know. And I really think that the Canadian snapshot is extremely helpful. But what's also helpful is looking at the individual snapshots from the provinces to really get a more granular approach here and have a much better reflection of what's happening on the ground in different parts of the country. Because even though we are under that same umbrella of Canada, these really are somewhat unique epidemics, and we didn't start from the same place, and we're not going to all be in sync at the same time. So it is helpful to have the Canadian view, but also to have the provincial views as well.
Yeah, that's something that stood out for me when Dr. Tam said an aggregate curve for Canada doesn't tell the whole story, and that we are really dealing with, as you suggested, regional epidemics, depending on where we are in different parts of the country. The suggestion from Dr. New there that we are in the first wave until summer, but not really, we don't really know what that means in terms of the loosening of public health measures. How accurate do you think that is? How realistic is that?
I think it is pretty realistic, and I think that what they're trying to say, but maybe just didn't say it explicitly, was obviously we need to do better. And even though there might be early evidence of these curves flattening out, we need to see a lot more than that before we can get back to normal. And in a perfect setting, what we want to see is not just a flattening out of the curve, but we actually want to see this reduction in the number of new cases per day, and we want to see that sustained for probably a couple of weeks at a minimum. Yeah. And if we sort of look at the timelines of what that's going to be in a perfect world, that's probably going to take us to the late spring and early summer. So I think that's a pretty fair reflection of where we're at and where we might be going in the next month and a half to 2 months.
Well, and Dr. Tam's point too, that we don't really know where we are in terms of the peak, but a good reminder I thought that she made was that on the other side of that peak is still 50% of the cases. So even if we knew the peak, it doesn't mean we're near the end of things.
Yeah, absolutely. That's a great point. And I really hope that the messaging from senior health leadership, like we heard today, but also at the provincial level, really reflects that. Because I think one of the concerns that many of us have who are following this closely and who are obviously on the ground and seeing patients and watching this from a public health or a clinical side and from a scientific side is, we are looking for wins, and we are looking for early signs of success, and we should be happy for early signs of success. But we also have to continue to remind ourselves that that's just an early sign of success, and by no means is that the end of the game, and that this is really going to be a big push for a long time. And while we're in this pre-vaccine era, this is going to be something that sadly we're going to be living with. And even when those public health measures, when we get to a point where those public health measures are slowly starting to lift, we've watched places experience this outside of Canada. There is this perhaps second wave of infection, so we have to do that extremely carefully, and we can prepare for this. We could talk about that another time about how best to prepare for it, but we're not out of the woods yet.
Just on the one of the scenarios they gave with the 2.5% of the population infected, 73,000 people in the hospital under that scenario, 11,000 deaths. I point to that because Theresa Tam also said that would start to be the pressure point for the healthcare system. Would that be your concern as well, that if we get to that point, 2.5% of the population infected, we are edging into a space for the healthcare system that becomes very difficult?
Absolutely, and there are a finite number of healthcare providers, of hospital beds, of intensive care unit beds, of capacity in the healthcare system in general, and of course they've done everything to boost capacity. We've heard about some places with I think, for example, in Mississauga, they're setting up additional beds in off-site places from the hospital. There's just a lot of different things. We're producing ventilators locally. There's measures to loosen some of the restrictions, letting international medical graduates practice for a temporary period of time. There's lots of different measures that are in place currently and in the near future that will facilitate stretching or boosting our capacity. But, it's just such an extremely important point, because there still is capacity. There still is a ceiling of how much the healthcare system can manage at any one given point in time. And this whole point of these physical distancing measures is so that we don't meet or exceed that capacity. Because if we do, it's trouble. And, we only have to look as far as New York City or Italy or Iran to see what happens in places where you're stretched beyond capacity. It's awful for patient care. And it has huge patient care implications in terms of the quality of care, and also for the healthcare providers as well. We see what happens when people don't have enough personal protective equipment. So we've got to do it. We've got to really do what we can to really make sure that we flatten that curve.
Let me just leave you with this. Obviously it took us some time to get these numbers from the national perspective. How valuable do you view them in terms of how Canadians should absorb them?
Extremely valuable. I think it's there was a bit of a sobering message that they had. They're looking at, some of the worst case scenarios and also where we could have been had there not been these measures in place when they were started. So it still is a wake-up call, and maybe people wanted to hear that we're doing okay and we just need to keep doing what we're doing. But I think one of the messages I took out of that was that although we're doing okay for now, there's still room for improvement, and we shouldn't be overconfident at some of the early signs of success. There's still room for improvement, even in places that are having early signs of success. We can all do better. And really, it's up to all of us to pitch in to get this done.
Okay, Dr. Bogosh, always good to see you and always good to talk with you, because we're always trying to understand this as quickly as we can too. Dr. Isaac Bogosh, thank you so much.
Have a great day.
Okay. All right. Let me bring in my colleagues, CBC's Catherine Cullen and Vashi Kapelas, the host of Power and Politics, of course, both here in Ottawa, because, of course, at the top of the hour, we will hear, we will wait then for the Prime Minister, who will come out around 11:15 Eastern. So I know you were both listening in closely. It was good. I wanted to go to the doctor first to get some scientific perspective on what we heard there. It took us, as I suggested, Vashi, a while to get here, but I have to say, I personally, as a journalist, found the information useful, even if it wasn't, entirely conclusive. We don't know exactly when it's going to end. We don't know exactly what's going to happen, but we certainly have a better picture now of things nationally.
Yeah, I think so, Rosie, and I think that we have been getting it in various iterations from all the provinces that have so far released their projections, but it's been difficult to sort of try and glean from that one central message, especially I think where, and you could see most of the questions from journalists were directed at this point, where these physical distancing measures and the sort of way of life that we now all have, where the timeline of that is concerned, because I feel like for most Canadians who are listening, they are of course concerned about the pressure on the hospital system in this country. They are of course concerned about how many of us could be infected and how many people could possibly die. And it was very beneficial to see the sort of frames of reference from that and the numbers put forth by these federal health officials. But I think especially for me, the new information, at least from my perspective, was mostly around that first wave, how long they see the epidemic that lasting, and the fact that we don't really have a definite timeline on that. But that even after the peak, as you mentioned, as you discussed with Dr. Bogosh, up to 50% of the cases can still occur. So now I feel like, even just as someone watching, not even a journalist, but sort of listening, that, okay, I'm going to have to live this way most likely until the summer. And even at that point, then it's really going to depend where I live. So what province am I in? What kind of testing capacity and testing system is in place? And what kind of surveillance system is in place? Because what Dr. Nuge really emphasized was that is going to depend on each province. And that is really going to sort of inform the degree to which these physical distancing measures can be relaxed. So there is still a big question mark on how that will happen and how it will unfold. But I think certainly from the perspective of just, this is how we have to live. If I own a business, this is what I have to try and plan for. If I have to try and pay the rent and the bills, these are the kind of timeframes that I'm looking at, with the caveat, the great caveat, that of course it depends on how we adhere to these measures, to what degree we adhere to them. I think it was informative in that respect. And I think also the fact that they expect smaller subsequent waves should also inform our behavior going forward, and certainly will inform the kinds or the direction each province takes in attempting to relax these conditions.
Yeah, I think those are all really good points, not only just in terms of how it shapes our behavior with public health, but you're quite right. Like, just on a personal level, how you plan your life for the next few months is important, and maybe this gives us a better picture. I just wanted to raise one point of context that my producer wanted me to raise, that we are currently at about 20,000 cases in Canada so far. So the very best case scenario that was presented to us at 2.5% of the population infected, that means more than 900,000 Canadians. That just really gives you a picture of how early on we might be in this as well. So, I mean, we heard that time and again from Dr. Tam, but we are in the early days of this, even though it may not seem like it or feel like it. Knowing when the peak is a different matter, but we are in this for some time. Catherine, anything that stood out for you as vitally important there?
Well, I think you made a really important point there, sort of emphasizing what Vashi is saying, which is that the takeaway, I think, for a lot of Canadians right now is that this is still early days, regardless of the number of scenarios we look at. I would also point out something that Teresa Tam said in terms of the caution that she is suggesting when we start thinking about relaxing these measures, and it's clear now that's a time off. She said, the moment that you release anything, the chain of transmission could ignite, right? So the incredible caution that officials need to proceed with when they start thinking about loosening these measures. But it's clear, Rosie, that that's still some time away.
Yeah, and until there is, as Dr. Bogosh was saying, a vaccine, treatment, whatever, this is really the only measure we have to protect ourselves. I want to just, as we wait for the Prime Minister, I only have about 5 minutes till the top of the hour, but I do want to hone in on the job numbers as well, because I expect the Prime Minister will be asked about those. 1 million people losing jobs in the month of March. Of course, we now know 5 million Canadians have applied for the CERB. They are staggering numbers, Vashi. It's sort of hard to wrap your head around. I think important to remember, these are each people, individual Canadians out there that no longer have work and aren't sure when they're going to have work again.
Yeah, staggering is the only word I can think of as well, Rosie. An economist had posted a graph that I think Catherine circulated to our newsroom that showed just, fluctuations, normal fluctuations in employment, and then a complete drop-off in the month of March. Also important to note, this data was collected between March 15th and 21st, and you think back to that period of time, that's when these social distancing measures began. That's when businesses started to close down. Yeah. We're now in the thick of it, and you can only imagine that things would be exacerbated by this point, which is, again, very staggering.
Yeah, we showed that chart as you were talking, because it is quite shocking. Okay, sorry, I actually am running out of time because I'm going to take a quick break, but both of you will be back in the 11 o'clock. Thank you so much, CBC's Catherine Cullen and Vashi Kapelas. Okay, we are going to take a short break here on CBC News Network. When we come back at the top of the hour, 11 Eastern, we will begin to wait for the Prime Minister, who will, of course, be asked questions about these models and the staggering employment numbers we just saw this morning. I am Rosemary Barton. You can keep watching. See you in a moment.